Good afternoon, I'm Dr. Marija Pavlovic, specialist of periodontology, implantology and oral medicine, with 19 years of work experience in the University of Dental University in Belgrade in Serbia, and currently 8 years in Medcare Hospital, Dubai, United Arab Emirates, Al Safa. Today, I will talk about the gum disease, which is all gum diseases are the most common disease in the world. One of the symptoms of the gum disease is bleeding of the gums. Bleeding of the gums are never normal. Healthy gums are never bleed. So, we will talk about how to prevent gum disease, how to treat gum disease, how to prevent as well bone loss. Mostly my patients ask me, what is, doctor, the cause of gum disease, and what is the cause of bleeding of the gums? On the first place is dental plaque, actually bacterial and microorganisms in dental plaque. We can tell that we have gum diseases, what is plaque indicated, and gum diseases non-plaque indicated. If we talk about gum diseases which is not plaque indicated, this is so many systemic disorders like leukemia, cancer, deficit of vitamin C. Also, we can find in the patients with heart disease who used high dose of aspirin. But if mostly 80% is plaque indicated. So how first of all, how to prevent? We can prevent as well at home. The most important thing is good brushing habits, good flossing habits, and one more thing which is very important, and I also have so many questions regarding this: can we use mouthwash or not? Because there is so many information that mouthwash is not good for the teeth, give like a grayish color of the teeth or affect enamel of the teeth, which is not true. Every mouthwash have one substance which we call chlorhexidine, and chlorhexidine also help to reduce bacterial and microorganisms in dental plaque. So always with the brushing, with the flossing, we need to use as well mouthwash. What is the most important as well is regular checkup with the dentist. For some people, we have that accumulation of the dental plaque is very fast. Regularly, every patient, every person needs to go for checkup every 6 months. But if we have case that the accumulation of the dental plaque is very fast, can be as well 3 months. How we treat gum disease, how we treat actually gum bleeding. So from the beginning, inflammation is only superficial in the gums. Sometimes we don't know that we have as well gum disease. We don't feel, we see only when we brush our teeth or eat apple, something hard, that the gums bleed. But always we will go to the doctor if we feel the pain. Mostly people, they don't go for the bleeding of the gums to ask dentist why is like this. So it's very important immediately to go. So what we do for the first treatment, which is regularly dental cleaning or dental prophylaxis with ultrasound device and the polishing. So this is also one step and kind how we can prevent that the superficial inflammatory tissue will go to the bone and start destruction of the bone, and we will have, of course, periodontal disease, and after losing the teeth. So it's very important. One more time I need to tell, this is the regular check-up for the dentist. If we have the case that it's a dental plaque is long time accumulated on the surface on the teeth, and there is no regular checkups, and the patients they didn't regularly clean the teeth, we have periodontal pockets and inflammatory tissue between the teeth, gums, and the bone. Then we will go for the second step. This is the scaling and root planing with the special instruments we call the scalers. So with this treatment, we will stop the periodontal disease, and we will stop progressive destruction of the bone. But sometimes I have as well patients who they come on the terminal stadium when they have already mobility of the teeth, which I cannot do anything. I need to extract, of course, these teeth, or to save other teeth which is not mobile with the flap surgery. Of course, all of us, we don't want to reach this stage that we will lose our teeth. The most important is that all of us, if we have even slightly bleeding of the gums, we need immediately to go to the dentist and to see what is prevention, what is the treatment. Because there is one very nice sentence which said, if your mouth is healthy, all body will be healthy. So now we can start with the questions. I can introduce my colleague, Mr. Wright. Good afternoon, Mr.
Good afternoon, doctor. Thank you so much for the amazing information. Doctor, what could cause the gums pain? Because I have a hole in my teeth. I think this person having some caries or tooth issue. Does it relate to gums pain?
So first we need to know that the pain cannot come from the gums. What can be with the gums? We can have bleeding, we can have swelling, and we can have different color. If it's inflamed, it will be dark red. The pain comes always from the tooth or from the teeth.
So gums doesn't give any pain?
Gums doesn't give any pain.
Okay. Doctor, can
Only can be pain from the abscess if we have complication of the periodontal pocket and periodontal disease. In this case, can be
infection.
Yeah, okay. This is abscess. Yeah, collection of the pus.
Okay. What's the reason of bleeding comes while eating banana? Could it be maybe there is some disease or some issue?
No, this is not banana, so we can eat apple, banana, anything. So it means that the patient have already gum disease. Already is inflammation or infection in the gums.
So any gum bleeding, there should be a reason behind it. It's nothing normal.
Yes.
Is there, doctor, something called sensitive gum? That it can bleed without any reason?
No. Teeth are sensitive. Gums cannot be sensitive. Gum bleeding only with reason when we have a high accumulation of dental plaque and the patient didn't go for the treatment.
So the scaling and polishing, it's recommended every 6 to 3 months depending on the...
Correct. If it's high accumulation of the dental plaque, the patient needs to come every 3 months, but regularly mostly is every 6 months.
Every 6 months.
Yeah.
Okay, doctor. Can we talk about the toothbrush? What kind of toothbrush shall we use on the gums, and how to brush the gums actually in a healthy way, not to scratch or cut? And at the same time to clean it?
This is a very good question, and every day I have these questions. There is two kinds of, actually we can tell 3 kinds of the toothbrush. We have the soft, medium, and the hard. Mostly soft brush we recommending after surgery because we have a wound and we need to take care about the wound. But regularly medium, because with the medium we can completely remove dental plaque from the surface of the teeth. So medium.
Medium is the best. Even for elderly people?
For older people, it depends. Mostly they have diabetes, so I can recommend in soft because we don't want it. They already have a recession of the gums because in the old people we have atrophic gums and already is exposure of the roots. So it's better to use the soft toothbrush.
Perfect. Doctor, someone is telling us I don't have any of the mentioned symptoms, but the tooth keep me awake throughout the night. Should I go for checkup? I think.
Of course.
Tooth pain at night is something.
Yes, this is connecting with the nerves.
Alarming.
Yeah, it's alarming, of course.
Okay, doctor. You mentioned the mouthwash.
Yeah.
What kind of mouthwash shall we look for, and what kinds shall we avoid?
Yeah,
because you find something so cheap and you find some other brands that are
Correct.
really expensive.
Yeah.
What shall we look
First
for?
of all, always you need to have consultation with your dentist, because like I said, every mouthwash have this chlorhexidine, but percentage of chlorhexidine is different. Some is high, for some is not. So if we have severe gum disease, severe periodontitis, we will start with a high percentage of chlorhexidine, because it helps us in the treatment to reduce the plaque, to reduce the percentage of microorganisms. For regularly lower chlorhexidine, there is so many brands available in the market.
So the concentration is the key.
Yeah, but I will tell one more time, dentist needs to prescribe and recommend.
Thank you so much, doctor. The next question is, what are the different kinds of periodontitis, especially for kids?
There is different types of periodontal disease, or how we call periodontitis. There is the juvenile periodontitis we can find in the kids. Yeah, this is true. Between 11 and 15 years, because of that is juvenile, and this is the rapid and always is ulceronecrotical type.
Okay.
Yeah, ulceronecrotical and acute. Then we have chronic periodontitis. All of us actually, we have chronic periodontitis, but its question is active or passive. So if it's active, so we have active like all these symptoms, what I said, with gums, plus periodontal pockets, plus starting bone loss.
Okay.
But with the active, rapidly losing the teeth.
Okay. Doctor, can you tell us more about the gums color? Some people, their gums are kind of whitish, gray, maybe they are smokers. Some people have dark red gums.
First of all, the normal color of the gums are light pink. Everything what is not like pink, so it means it's not healthy, it's unhealthy gums. But also I need to mention as well, it's also a right good question. I have so many patients, they come and they tell, my gums are black, with like black melanin pigments. This is normal in the people who have dark hair. Like it's melanin in the skin, we can find melanin in the gums.
Okay.
This is for them normal. But of course, in the hard smokers, you will find, of course, little darker grayish the gums with the accumulation of dental plaque, which is give this color. And dark red, when we have these cases, like I mentioned, inflammation of gums, different periodontal disease, gum disease, in systemic also disorders. Yeah.
The dark red is an indication
Everything
of something abnormal. Better
correct.
to visit your dentist there.
Always.
Doctor, one more question. Are tongue scrapers good? Can we use them every day?
Very good question. Yes, of course, because there are so many researches and studies, and they found that the most higher percentage of microorganisms oral, I talk about oral cavity, is on the tongue.
Really?
Yeah, and I'm very happy when I see that some of patients, they used already, because we are lazy sometimes, we don't have time to take care completely about oral hygiene. So it's very good, of course, to use, and this is also one step to prevent periodontal disease and gum disease.
Nice to know that. Doctor, let's talk a bit about brushing. There are people that obsessed in brushing their teeth after every meal, every snack, up to 5 or 6 times a day. Is that healthy, or it's more than enough? Is it harmful?
So in everything in the life, you need to have,
balance,
to have some balance. Will not be anything negative for oral hygiene. It's good, but it's not necessary. It's good 3 times per day, more than enough.
Is there a saying that over brushing 5 or 6 times it makes gums recession faster.
Bravo, can. Yeah,
It can.
can be, especially if the patient have already, because gum recession is mucogingival anomaly. So 30 to 40% of population, they have this mucogingival anomaly. So with like this, maybe patient doesn't know, that have, but with like this brushing, of course, can be worse, can be more progression.
Doctor, electric toothbrush. Tell us about it.
Always question. Now it's trend really in the market to use this electrical toothbrush. So I prefer the manually this technique. There is some where is contraindicated to use, especially if the patient have this mucogingival anomaly. So with recession of the gums, because with the electrical you cannot control. So recession, of course. So recession will be more, and you will damage the gums. It's good. It's good to use, but before, when they start to use, any patient, any person needs to come to the dentist. Dentist needs to explain how to use. Okay, but I prefer to use the manually.
Manual toothbrush.
Yeah.
At least to control the direction of brushing.
Yeah, I will tell. There is also so many studies they compare, and they found more problems in the group of the people who used electrical.
Okay.
Yeah, it's not good advertising for the market, but
they may hate us, but we are talking about
we talk about
gums.
Yeah, I'm periodontist, so for me it's very important that this will be healthy gums and or periodontitis.
Doctor, someone got two questions.
Okay.
What kind of precaution to prevent gum bleeding? And the next question from the same person: what treatment for severe gum bleeding?
Thank you for question. First part of
what kind of precaution to prevent gum bleeding?
Okay, so like I said, good brushing habits, good flossing habits, regular checkups with the dentist. This is very good. Even something, if they notice slightly bleeding, swelling, different color, immediately to go to the dentist. Like this, we will prevent. But good oral hygiene, this is very important. And dental floss, because you cannot remove all dental plaque with the toothbrush. Especially for us is important interdental space. The most accumulation of the dental plaque is in between the teeth. We call this interdental space. So floss always should be with the patient. Okay, second
question: what treatment for severe gum bleeding? I think
for visiting
the doctor is the treatment.
Yeah, for severe gum bleeding, first we need to see is only gingivitis. Gingivitis we call if is inflammatory tissue only in the gums. So we will do dental cleaning, dental prophylaxis, okay? And if it's not, we will add scaling and root planing if we have periodontitis starting or periodontal disease.
Okay. Doctor, brushing the gums, in which direction? From the gums to the tooth, or
brushing? Can I demonstrate?
Sure,
it's very
please.
nice. We have now. Okay, like we explain to the children, in the upper jaw always we go from the up, like this. We can see from the up to the down, like this. Never use circle, ways. So like this. Also occlusal inside, and in the lower from the down to up. Like this.
So always from gum to tooth.
Yes.
On both jaws.
We need to start from the gums, then on the occlusal.
Maybe that's the difference between manual and electrical brush, because
Correct.
that keeps on rotating.
Rotating. This is because if we rotate and here is a recession of the gums, we will provide more recession and more sensitivity of teeth. Because of that, some patients, they don't recognize the sensitivity from the teeth or sensitivity from the gums. If we have recession, of course, when they brush the teeth, it will be sensitivity from the tooth because it's recession.
Does a rinse or mouthwash help? Yeah, we said mouthwash.
Yes,
helpful. And treating.
These three things are very important. So brushing, toothbrush, toothpaste, floss, and mouthwash.
Perfect.
Every patient needs to make consultation with the dentist. Which percentage of chlorhexidine, which percentage of mouthwash will use?
Doctor, Can we reverse the gums recession?
Only with the, it depends how much is gum recession, but we go with the mucogingival surgery.
Okay.
Mucogingival surgery we cover, but we need to decide. It depends how much is. If it's small recession, no need. With good toothbrushing and massage of the gums, we can keep on this stage.
It may grow again.
No,
or
growing
no?
again. No,
It may stop.
Stop.
Okay.
Yeah.
And the surgery, can you explain a bit about the surgery, doctor?
Yeah,
Do you transplant gums?
Yeah, surgery is like this. There is auto transplants, which we take from the palatum, which is the results are more better because it's our body. Okay, so we cover with this is like apically position the flap. So we will cover this recession. Or now in the market we have so many membranes which is same like our tissue, so we can use also this. Also, they are very good results.
Perfect. Thank you so much, doctor. It was really great. Hope it was helpful to take care of your teeth, even your gums. Usually, many doctors talk about teeth, but today we are talking about the next thing, which are the gums.
Yeah.
Thank you so much, doctor. Thanks for your time and information.
Thank you, Raed. It was very nice to talk with you. Thank for the people who asked me very nice questions and good questions. So for all the consultations, you can find me in Medcare Hospital. I'm full-time here every day except the Friday. Medcare Hospital, Al Safa. Thank you. Thank all.